Hello again, and Happy New Year to everyone. This is Pat Marsh, your host for the PM Talk Show. As usual, we have knowledge that's coming to you that is powerful for the community, and today we have with us Dr. Sheree Miller, who is a nurse practitioner and a nursing instructor at Southeastern Louisiana University here in Hammond. How are you, and Happy New Year to you.
Same to you, Ms. Morris.
Thank you. Thank you. We have you for coming on. Thank you for coming on, and we want you to know that healthcare is an important issue now for everyone, especially people my age, so I'm going to listen real attentively to what you have to say about what we need to do, people my age and younger, as far as health is concerned. So why don't we just begin by welcoming you and giving you the camera and let you tell us what you do and how you can help us health-wise.
Thank you. I would like to thank you for this opportunity. And what I'd like to share is that with the new Affordable Care Act and also with the dynamic changes with the healthcare reform, that is very important that everyone try to the best of their knowledge to get insurance coverage to be able to meet their healthcare needs. Usually by the time patients seek medical treatment, there are a lot of things that could have been prevented. And what we at Total Healthcare Associates have discovered here in Hammond and also in the Tangible Hope Parish area, that there are still quite a few residents that have failed to seek medical treatment. And statistically in this area, we have a population that has chronic comorbidities that need to be medically attended. So at Total Healthcare Associates, our motto is your health is our priority.
Right, I see that.
And we are nurse practitioners who have collaborated also with an area physician whose specialty is internal medicine and also infectious disease. And based on the area, we need to focus on getting patients in promptly, treating them and educating them. Education is a major part of self-care management, and without the patients being properly educated, then that would pose an impact on the end result of treating chronic comorbidities and chronic diseases. So we've come up with strategic, innovative interventions that we can get patients in and educate them, and also when the patient leaves, that they have been well informed of their problems. And also we try to get the patient as involved in their self-care management so that at the end of the day, they will be satisfied in the goals that have been set to make sure that we have positive outcomes.
Right. Healthcare is very, very important, and it makes for an individual doing everything they can to take care of it early, right?
Right. So now insurance companies have established a component with the benefits that for preventive measures. So a lot of diseases can they can be prevented as far as identifying the issues early on and to seek proper treatment, and then those problems can be handled appropriately. But the problem is getting the patients into the clinics, and that is what we want to do. We do treat episodic care, where those are problems that you wake up sick and you can give us a call and you'll be able to walk in.
Okay.
Otherwise, other areas, providers, they have such a impacted schedule that they're unable to manage those patients, or else they cannot get those patients in, and by the time they get in, the problem is over with. So we try to get those patients to come in as soon as they have identified that there's a problem going on.
Okay, I see where you have Dr. Kashlova He's a medical doctor and he also specializes in infectious diseases. He's an infectious disease specialist, right?
Yes, he is.
Okay.
And in the North Shore area, our statistics have changed drastically with HIV and hepatitis C being co-diseases that needs to be addressed. And we do have providers here in the area, but with the high prevalence of both HIV and hepatitis C, with the baby boomer population, there are quite a few of the baby boomers who have been exposed to hep C and they don't even know. So that is something that we as primary care providers need to start testing all baby boomers that are coming into the offices to identify the hep C, because hep C now is something that is treatable. Okay. And they are coming up with more medications that are not as harsh, you know, on the bodies that they've had in the past, but they have medications now that the treatment is only, you know, 12 weeks and the patient is completely treated with the hep C. So this is something that needs to take place with the baby boomers, with that population is trying to identify the hep C status.
Okay, so that disease is contagious, right?
Yes.
Okay. So is it, I know it's treatable, but is it curable?
Yes, it is.
Okay.
And basically, you can take the medications. They have new medications that are coming out on the market constantly, and they are having many advertisements of those drugs. So it's very important to get identified as you know, a patient with that with the hep C status, and once that takes place, you get treated and it's done.
Okay. At one time, the big thing was HIV and AIDS. Is hep C now more prevalent than HIV used to be? Or AIDS?
Well, now with, I would say, with HIV, by the time that the patients realize that they have been infected, sometimes, you know, they have gotten into what is called the AIDS stage. But it's very important that everyone get tested, especially if you are practicing high-risk behaviors. Also, with the hep C, it's more prevalent now because of the increased use of IV drug.
Okay.
IV drugs have come on the scene, and back on the scene, more prevalent, and it's not just with the older population. We're seeing hep C and HIV more, you know, in the younger population now. So, of course, with the younger population, they are not the ones who go to the doctor. So those are the ones, that's the population that we need to reach out to and try to get them to come in just to be tested. I'm
a little bit curious about something. How is it that a person can tell, just if they've had not had any treatments, they didn't know anything, how is it that they would be able to tell whether or not a person has hep C for the first time?
Okay, well,
what are some of the symptoms is what I'm asking.
Well, the thing is that usually by that time that the patient has been, if they're being treated for hep C, what happens prior? A lot of times they come in with flu-like symptoms, and there are many other symptoms that comes to place before they actually realize, okay, there is something going on with me. So what we advise that a lot of times it can lie dormant for years. It's according to the health of your liver. You know, if you have a healthy liver, it take a long time for the disease to you know, attack the liver. So that's why it's important to identify it as soon as possible, and then to come in and get treated for it. But I've seen so many patients that I've tested them, they're positive for Hep C. They said, well, I really didn't even know I had this. And then once we get them into the regimen of getting treated, then, you know, they're fine after that. But by the time, if you ignore it and you're starting experiencing symptoms, the disease itself has advanced. And it's more difficult to treat.
Okay, once it gets to that advanced state, how would a person know what would be going on with their body? And I'm thinking about the yellowing of the white of your eyes.
That's correct. And sometimes the abdomen becomes distended and tender. Also, there's fluid retention, you know, in the lower extremities, and they're very fatigued, and they know that they have body aches, and they know that there is something going on.
Have you ever run into any occasions as a doctor with a patient who has that disease and they're in denial?
Yes, they are. I've had that to happen, and usually they'll say, you know, that, oh, I have this problem, but it goes away. It's transient. You know, I feel like this, and then once it takes its course, they think it's like a virus, and once it takes its course, that it's over with. But when it comes to the advanced stage, it's there. It's not transient. It's there. It's permanent. You know, so. It
For
can,
the life of that individual.
Correct, because it can go into cirrhosis, you know, and liver cancer.
Okay.
So that's why it's most important to identify the exposure and the diagnosis of Hep C, to get it treated, and then you're okay. Because you want to keep your liver, you know, healthy.
That's the filter for everything,
Yes,
right?
yes.
Okay. Is that why I used to hear people say all the time, oh, I'm not worried about it, my liver will cure itself? Okay, that's where that came from? Okay.
And sometimes the liver, you know, we have a tendency to really to beat up the liver. You know, you want to keep your liver healthy. You want to keep your kidneys healthy, because yes, they are the metabolizers and they are the filters of what we put into our bodies. Yes.
Okay. A lot of people feel that, you know, if I can do my veggies, I can do my exercises and eat right and all of that, is that a deterrent from getting liver cancer or getting Hep C? Some of it.
Well, it's part of wellness, you know. So it really would not, you know, completely. It won't keep you. It won't deter you from, you know, acquiring the disease if you're exposed. But most importantly, you know, eating healthy, exercising, those are important interventions to wellness, to, you know, to health and wellness.
Okay. Okay, we're going to take a break now, and when we come back, we want to talk about some of the other specialties that you deal with in your profession.
Yes, okay.
We're going for a break, and we'll be right back.
You probably already know that if you buy alcohol for me or my friends, it's illegal. But what you might not realize is that if you host a party where alcohol is provided for anyone under the age of 21, you could get sued, go to jail, or worse. Somebody could get hurt or even die. Is that a risk you're willing to take? So if you care about teens, don't provide the means.
Welcome back to the PM Talk Show. This is your host, Pat Morris. Today we have with us Dr. Sheree Miller, and she's an internalist. Also, she is a nurse professor at Southeastern Louisiana University. How long have you been teaching nursing?
2 years.
Okay.
I have been teaching 2 years, and I've also always had a passion for education. So I've been practicing as a nurse practitioner for 10 years, and then I decided to go back to get my doctorate in nursing practice. Okay. To become a nurse educator. So I've been teaching full-time with Southeastern Louisiana University.
Okay, well, we're glad to have you as our guest today, and I want everybody to know that you're good at what you do. And I know that because we worked together in multi-practice. I was on the obesity end of kids, and you were taking care of everybody. But during the break, we were talking about some of the things that you do in your profession, like primary care or episodic care. Is that your sinuses and upper respiratory infection and that sort of thing?
Yes.
Hey, let's just tell my audience what it is you do so they'll know who you are, where you are, and what you do.
Okay, so we're located at 15825 Professional Plaza, Suite C, here in Hammond, right off of Club Deluxe Road. And we've been there since September 2015. And as primary care providers, we're able to care holistically for to care for the entire body. And that's from ages from 0 through the lifespan.
Okay.
So with primary care, we can care for any disease process, meaning upper respiratory infections, bronchitis, pneumonia, diabetes, and that is my passion, diabetes, because I conducted research in rural health clinics in Louisiana, and doing my research, I was able to look at the prevalence of diabetes, why diabetic patients are not as adherent to their self-care management. So while looking at that, I found that a lot of patients felt that once they have become diagnosed with diabetes, they felt like it was the end of the world. Well, my parents had it, they died with it, and I just have to live with this disease. But it's, with diabetes, it's something that of course, every day you have to think about what you're doing constantly, what you put in your mouth, what you drink, and taking your medications. But the way that you perceive the disease is the outcome. So with diabetes, you can basically look at how you can prevent any complications. That's most importantly, because it's the complications that leads to a negative, outcome. So with the research that I conducted, it was with group medical visits where I would take a group of 10 to 15 patients, and on a week-to-week basis for a total of 6 weeks, we discuss every component of diabetes from A to Z. And doing the research at the end, we noticed that those patients who participated, they had a lower A1C, hemoglobin A1C, in 3 months by merely sitting down with their peers, sharing information, and when I rechecked them in 3 months, it was just amazing to see significantly how their A1Cs had dropped.
Okay, and I can relate to that because sometimes when you get upset to the point that your blood pressure goes up, your heart rate goes up, it's usually due to stress.
Correct.
But when you get somewhere quiet, it takes a minute to get it back almost to where it was. But from that episode, you learn, oh, I don't want to do this.
Do that again, right. And so by merely changing and tweaking certain behaviors, it has a major impact on your blood sugars. And by merely exercising, at least 3 times a week, when you exercise and affect your blood sugar for an additional 24 hours. So if you exercise for 30 minutes, brisk walking, that means that every other day, if you're actually doing the fitness, then your blood sugars are being constantly impacted for the entire week. And you will see a drastic change in the blood sugars.
And that doesn't seem like a whole lot when it comes to your health.
But it really does. And I've always taught my patients that if you be cognizant in what you put in your mouth, don't eat anything white or anything yellow, because those are carbs that converts into sugars.
Okay.
That too will impact the blood sugars.
So watch the sweets.
Sweets,
Things that
any
turn into
starches,
sweets, yeah.
carbohydrates.
Okay. Be careful with that, and it'll help control
Yes.
the spikes in
Right.
sugar.
And then when I have patients that, when we go through the diabetic education component with the meals, I say, just think about it. Anything white or yellow is what you want to stay away from.
Okay. Do you think it's best just to drink water rather than the sodas and all
Oh,
of that?
most definitely, because with water, your body is 66% water.
Okay.
So if you're drinking sodas, even though if they're a diet, they have a lot of sodium. And sodium elevates blood pressures and causes fluid retention. That elevates blood pressure. So water is your best friend.
I don't know if you can answer this or not, but if you drink a lot of sodas as opposed to water, and then you do a sudden crash of, I'm just going to drink water, does that matter? For a long time, I'm not going to drink soda. I'm just going to go on a crash and just drink nothing but water.
That's fine. That's fine. But I've
But
completely.
if there's something that has caused your sugar to spike, like your yellows, starches, your all of that, and you just want to go on a sudden, oh, I'm not feeling well, I know what I can do. I can just drink water for about 2 or 3 months, and that's going to cure everything. And that's not true, is it?
No.
Okay.
No.
Give a girl a try. Okay. So it's best to be careful and do what you're supposed to do in the beginning.
Yes.
Kind of rhetorical, but
Right.
it does make sense.
And when with patients, the patients that I have that are diabetics, I reorient them annually with a crash course, because sometimes you forget.
Yeah.
And just to have that 15 minutes of important, strategic, innovative interventions that you can do to help with the diabetes, and then I give them a packet that they can take home, that if they have any further questions, that they can always call back, and we'll clarify anything for them. But when they come to me, they bring a folder, and in that folder is their portfolio of their medications, their summaries that they receive each visit, and we look at that portfolio to come up with goals and plans, how they're going to continue throughout. So whenever they come every 3 months, they bring those folders in, and we sit down and talk about it. We look at the lab works, and we see what we need to do as far as more or less trying to tweak the plan. And everybody is unique.
Right.
Everyone is different. Everyone is an individual.
And that's something we have to learn.
Yes.
What may affect you may not affect me, and vice versa.
Right.
So it's best to be cautious of what we're doing, especially if we know that
That's
we have
right.
these orders.
Right.
One of the things that we will have is your hours of operation, your phone number, and your website address, so that people will be able to go onto your website and
Yes.
find out, and that will be up on the screen. But I'm glad that you have Dr. Kashlova, Miss Elise Hartz Hall. She's a family nurse practitioner, right? So she does a little bit of everything.
Yes. And she was one of my former students.
Okay.
She worked with me at Atlanta at the multi-practice when she
Okay.
was enrolled in school.
Okay. Well, you have a lot of acronyms behind your name, so I'm just going to let you tell what they are.
Okay. D&P is a doctoral nursing practice. F&P is family nurse practitioner. And BC is board certified through ANCC.
So you know what you're doing. That's the thing. You know what you're doing. That's what that means. People like myself. Oh, she knows. I can go to her. She'll know and be able to help me. But I want you to know that we are very happy that you started your own practice. Congratulations.
Thank you
for doing that.
Thank you. And I'm working with other faith-based organizations here in the area. And in the A-Meet area on February 27th, which will be my birthday.
Happy birthday.
Thank you. We will be hosting a health fair in A-Meet at Butler's AME Zion Church. And we will be offering free HIV screenings.
Great. Great.
And also we'll be doing diabetes screenings, and we'll be checking blood pressures, and we have a host of other things that we're providing in the community. So we're asking everyone to come out to support us, and also, if you will please just share it with the community that we'll be at Butler's AME Zion Church on February the 27th, 2016.
Y'all hear that? And it's free.
It's free.
It's free. Come and see what's wrong, or even if you have a problem, even if you don't, you need to know.
And there will be a host of other healthcare providers that will be assisting us in the health fair. And if you have any questions, jot them down and bring them, and we'll be able to assist you as to the best of our knowledge.
Okay, well, you hear that, people. You got some free health care coming in next month, and we'll be airing this to remind you and let you know what's going on. And churches, pastors, get it out to your members, because you won't help the members shouting in church. Them shouting in church.
And yes, and that's been
that.
Sponsored by Butler AME Zion Church through the missionary department. And the coordinators are Miss Kendra Walker and Miss Angela Lovin, who's spearheading the health fair.
Okay, well, come out and check on your health, and remember the operative word is free. Certainly want to thank you for joining us today, and we're glad you're in business now. We'll be bringing you back to talk about some of the things that's going on, and maybe next time that you come, talk about some of the conditions, not necessarily the medical conditions, but the things that's going on in the medical field that will determine whether or not you are even eligible for the services now. And that's a very concern for a lot of us. Well, thank you for coming.
And I thank you, Ms. Morris, for this opportunity.
Thank you. This is Pat Morris, your host for the PM Talk Show. We want to remind you that knowledge is powerful, knowledge does matter. Happy New Year to everyone, and God bless.